So here we are. Hopefully you've watched the other three categories. This is our final category. And hopefully you've learned a lot, or maybe you're reviewing them a few more times. We do have study cases that do illustrate some of the issues that come up that we see with most every patient that comes through. We see something that is of concern. And hopefully we don't have any major flags for you. And unfortunately, this category carries more concerns than non-concerns. So if you hit on almost anything in this category, you'll probably be a red or at least an orange, or unfortunately, we don't even know. It has to do with your medical and dental health history, or how well you basically will heal during any circumstance, during a surgery or implant healing or things like that. Once again, I say this over and over again, bone healing must occur, meaning it's a biological event. If you're having implants or healing to a graft or a sinus graft, that the bone has to heal. And bone is a very slow healing tissue. And it does take time, and not all of us have the capacity to heal. Even if we don't have any signs of some sort of autoimmune disease or radiation treatment from cancer, our bone in particular is really kind of fussy. It does have to have some vitality, and we talked about this with D1 bone or D4 bone and things like that, but it does have to have a capacity and a need to kind of heal. So given that, let's get started on the medical dental history treatment. Once again, our four categories. We're in the last category here, and in particular we're looking at some of these highlights. It doesn't it's not a comprehensive list right here that I'm talking about, and you'll see we do have an other down here at the bottom that we have on our sheet that has lines basically that you will fill in, or we can fill in something else, because this is just a kind of a bullet point of what we're immediately concerned with what most people bring into us on any given day, and we try to rate them as best as possible. So looking at chronic autoimmune diseases, we're looking at mostly diabetics, lupus patients. Then you see people that have rheumatoid arthritis, or they have Sjogren's syndrome and things like that. They can affect things different ways. So for instance, Sjogren's syndrome is known, one of the classic ones, for dry mouth. So we're looking at that, looking at decay, teeth, problems, overcoming what medications could help that. Myasthenia gravis is a muscle disorder, so maybe you can't open as long or chew your food as hard or something like that. So there's so many things that happen. And like when you look at diabetes, there's also a degree in which diabetics are kind of on a scale. And it's very hard to determine what exactly you can say about those particular diseases, as they are different in everybody. Smokers are an interesting lot. I'm not really sure. It just seems to be one of those things that we have a lot of evidence for, and it's a very logical thing that they're not good for your health. So I kind of push them always to the red, because I never can trust what a smoker actually says. I have too many smokers that believe that they're it's not them, that they're going to get cancer, or they feel perfectly healthy. And I think that's the masking of the nicotine, the addiction to nicotine, the uptick of adrenaline or whatever it might be that the nicotine is acting on somebody. But I do hear a lot more from smokers for sure about the honesty on how much they actually smoke, and maybe they believe what they're saying, or they're in complete denial of that smoking actually is bad for your health. So I'm not really sure how to judge this category, other than they're their own human experiment, and unless they kind of understand statistics, the statistics are behind the idea that smoking is just simply not good for you. So I just always put you in the red. Then people bring up vaping's a new thing, and I would say, well, clearly we now know after a couple of years of vaping that we're having these lung diseases. I can only imagine what's going to come up across the board for other things. So why are you just trading one bad habit for next? So seek some help for smoking if you're a smoker. Osteoporosis. This is a very clear and cut one, meaning it's already disease of the bone, and so I would always kind of put you into this category here in the red. Because I don't know. Bone has to recycle. Bone has to maintain a certain strength. If you don't have that ability to kind of rebuild bone, then your bone, it simply won't work for implants or something like that. And that's an unfortunate scenario. That limits quite a lot of treatment planning when you go down that path. So my recommendation for osteoporotic patients is definitely do 3 or 4 cleanings a year, because you don't want any sort of periodontal disease. That would doom your natural teeth. For those that are already edentulous, that's a very difficult thing to handle when you're osteoporotic. Bisphosphonate drugs are just, I'm not a fan. I've never been a fan. And there's a history of osteonecrosis of the jaw while these drugs are doing what they're doing. Now, these drugs are really just meant to harden the bone, and my experience is that they make the bone more brittle, and I have a feeling it's really just calcifying the collagen of your bone. Your bone is made up a lot of collagen, obviously the minerals, calcium phosphates and things like that, but the collagen's kind of that rebar in the bone, and I think it's really what it's doing is just probably calcifying the collagen. Which doesn't really mean that you're going to have any healing capacity. So once again, not only I doubt you're limiting your healing capacity of your bone, or you're probably masking a few things with taking these drugs, but I have concerns when a drug isn't allowed to be taken past a certain time point. So a lot of these drugs have a 5-year time limit to them, and you cannot take them anymore. They're really fat soluble, and they really stick in your body. Your body does not get rid of this at all, and it just keeps building up, and you will pretty much have it for the rest of your life. So I would very much stay away from these drugs if it were me, and you have an option at that point. If you don't have an option and you need implants, or now you're 5 years past and you're not taking the drugs anymore, please let your physician know, or oral surgeon, or anybody doing oral surgery, because there's a higher incidence of osteonecrosis of the jaw once you start doing surgery in the jaw, if somebody's been on these drugs for a while or is currently taking them. So just beware of that. Radiation treatment. This is actually one that I have a little bit more hope on, because it depends on so many variables. You have variables of type of cancer, the size of the cancer, the aggressiveness of the cancer, where is the cancer located. But basically what happens is that the radiation just kind of hits a lot of other things too, and surrounding tissues, and typically in the mouth, if you had radiation treatment, you're probably going to be knocking out a lot of bone healing cells. So a lot of the osteoblasts and the osteoblastic activity becomes much less. Now, to what degree, you don't really know. So I've had radiation treatment patients in the past. They've done pretty well, better than lupus patients and better than some other patients, diabetics that are more severe diabetics. So this one is kind of a yellow to orange or red, but it's really, really hard to tell or really know this. Here's the other pile. So we have things like Paget's disease, rickets, osteomyelitis, and there's so many of these that it's really hard to know. Once again, you're probably just going to be in the red here or orange-red, and it's kind of a case-by-case scenario. Some people already have had implants. I would say, a good idea would be to, when you extract a tooth, maybe follow that socket site, the healing, 4 or 5 months later, if there seems to be bone there when you're putting the implant in, I think that's a good sign that there's possibly going to be some healing around that implant. So this could be probably more of a yellow to red, but it's up in the air. That concludes all the 4 categories. I'll talk a little bit more about the overall assessment outcome, kind of general idea. But I think if you've watched to this point, you probably got a very, very good idea of what we look at and why we look at them, and how important it actually is to look at your case prior to starting a case. And you can see that now you would be more informed and more aware of your choices on what type of program might be best for you. Great.